Here we have a laser and an electrical combo targeting the suboccipital nerve, specifically at acupuncture point gallbladder 20. Next, we connect to the trigeminal nucleus via the infraorbital nerve located just below the eye, as shown here.
Does that feel okay there? You still feel it?
Finally, we interface with the brainstem, particularly the trigeminal nucleus, through the supraorbital nerve illustrated in the last clip. The device we're using is a cutting-edge combination laser electric stimulator. Now let's dive into an intriguing method for relieving migraines and head pain, ear insufflation. What's that, you ask? It's simply the process of blowing air into the ear, inflating the ear canal using a kinetic otoscope, or for those on a budget, a handy alternative known as the ZOC device. To kick things off, we'll explore the innervation of the ear canal and the outer surface of the tympanic membrane. This will help us understand how we can leverage this technique to assist patients dealing with migraines and other head pain symptoms. Let's get started. The external auditory canal receives sensory input from 3 different cranial nerves. Arnold's nerve, a branch of the vagus nerve, supplies the posterior and inferior regions. The auriculotemporal nerve from the mandibular division of the trigeminal nerve innervates the anterior and superior parts. There's also a small contribution from the facial nerve through its posterior auricular branch. The outer surface of the tympanic membrane, or eardrum, has dual innervation. The majority is supplied by the auriculotemporal nerve from the trigeminal system, while the posterior section receives sensory fibers from Arnold's nerve, the vagus system. This complex neural arrangement explains several important clinical phenomena. The ear cough reflex can be triggered when the ear canal is stimulated, working through the vagus nerve pathway. The rich sensory innervation explains why ear infections can be exceptionally painful. The shared innervation between throat and ear via the glossopharyngeal nerve helps explain referred pain patterns that clinicians observe between these regions. Finally, it provides an interface to the 5th cranial nerve and the potential to alleviate head pain. Insufflation. To blow into is the act of blowing something such as air, a gas, powder, or vapor into a body cavity. Insufflation has many medical uses. It can be a very effective way to quickly modulate the headache circuit. The ZOC device is illustrated to the right of the slide. Now let's examine a groundbreaking 2013 case series published in Functional Neurology Rehabilitation Ergonomics that explores this novel therapy for migraine headaches. From the study, migraines represent a substantial burden in our society, severely impacting quality of life for chronic sufferers. This study emerges from a growing functional approach to neurorehabilitation that marks a paradigm shift in neurological healthcare, as the field now increasingly focuses on assessing and optimizing nervous system function, exploring effective non-pharmaceutical and non-surgical therapeutic strategies. The findings were remarkable. 9 subjects experienced rapid, complete, or near-complete relief from their headaches after ear insufflation. 3 subjects reported only moderate relief, while just 1 subject showed no response to the treatment. This represents a significant success rate for a non-pharmaceutical intervention. This comprehensive 2024 review from Frontiers in Neurology examined the broad applications of sphenopalatine ganglion stimulation across multiple medical conditions. The systematic review analyzed 36 randomized controlled trials of varying quality levels and to evaluate treatment efficacy. The findings revealed that SPG stimulation demonstrates significant effectiveness for several conditions, particularly allergic rhinitis, ischemic stroke, and cluster headaches. For ischemic stroke, the treatment significantly improved 3-month outcomes in cerebral cortical infarction patients. And for cluster headaches, SPG stimulation demonstrated statistically significant relief. The treatment also showed promising results for several other conditions, though the authors note that additional high-quality research is needed to fully establish efficacy for some applications. A prospective study demonstrated significant pain reduction in trigeminal neuralgia patients using SPG targeted Botox injections. While temporary side effects were common, all resolved within 3 months, offering a promising option for medication-resistant cases. This 2024 study from the Journal of Clinical Medicine directly compared 2 different nerve block techniques for episodic migraine patients. In this prospective single-blind randomized study, researchers divided patients into 2 groups receiving either greater occipital nerve blocks or sphenopalatine ganglion blocks. This protocol was identical for both groups, weekly blocks for 4 weeks, followed by monthly blocks for 2 months. While both techniques demonstrated significant improvements across all outcome measures, including pain severity, headache duration, frequency, medication use, and disability scores, the greater occipital nerve block group showed significantly better results by the 3rd month of the study. This provides valuable comparative data for clinicians selecting between these treatment options. This large-scale study of repeated Botox injections showed impressive response rates for both chronic migraine and cluster headache patients. The benefits were maintained with subsequent treatments, particularly in cluster headache cases. These studies collectively demonstrate the versatility of SPG targeted treatment, including stimulation and blockade, across different headache conditions. While some applications show clear benefits, others require further investigation to establish their role in clinical practice.